Hi everyone. Today in this video let us compare semaglutide versus phentermine. Overweight is one of the important problems that can lead to various types of systemic complications. One of the important effects of overweight is the cardiovascular complications. So people with overweight may have increased risk of stroke, myocardial infarction or cardiac arrhythmias. And in such people, we can also observe elevated blood pressure, which may further complicate cardiovascular functionality. That's why overweight and obesity pose an important risk for cardiovascular functionality and they should be thoroughly controlled. Another important effect of overweight is the risk of diabetes. So in the people, we can often observe diabetes coexisting with the overweight. In such people, cardiovascular complications are further enhanced, which requires the management of both diabetes as well as excess weight. When the weight is increased, it can also increase the pressure on the musculoskeletal system. On the bones, it can increase the pressure, which may increase the risk of fractures and decrease bone mineral density. All such complications are well connected with overweight. That's why we need few of the medication to treat this excessive weight. So many types of medications are available. Among them, two popular drugs are semaglutide and phentermine. Semaglutide is available under the brand name Wegovy, whereas phentermine is available in the different brand names including Adipex P. Both of these drugs are different in their chemical nature, but they can reduce the excess body weight. Semaglutide is one of the peptide having a large structure and it is having a structural similarity with glucagon-like peptide. On the other hand, phentermine is having a structure like this. It is an amphetamine derivative. Even both of these drugs are chemically different, but they can reduce the body weight. But among these two drugs, which is better? Each drug is having its own advantages and limitations. So today in this video, we are going to see 10 comparisons and differences between semaglutide and phentermine, and we will discuss which may be better, which depends on so many types of factors. So all these points we will cover in this video. Please don't forget to subscribe to our channel and hit the bell icon to get the notifications on new updates. So now let us start our discussion, semaglutide versus phentermine. First one is a mode of action. How semaglutide acts to control the body weight. Semaglutide is classified as GLP-1 receptor agonist, glucagon-like peptide 1 receptor agonist. So this drug activates the GLP-1 receptors, which are natural incretins present within the body. On the other hand, phentermine is one of the sympathomimetic. It is also classified as anorectic or appetite suppressant. This drug increases the release of catecholamines within the CNS, which reduce the appetite. Both semaglutide as well as phentermine can act on the CNS and they can reduce the appetite. So one of their primary action is to control the appetite centers within the CNS. But they act in different way. Semaglutide acts on the CNS, which are expressed with GLP-1 receptors. When these receptors are activated, it can control the appetite centers within the CNS, which results in the decreased food intake. On the other hand, phentermine acts on the sympathetic neurons. These sympathetic neurons are having one of the transporter on presynaptic neurons. This transporter is nothing but NAT, norepinephrine transporter, which is responsible for uptake of norepinephrine. Thereby it can reduce the action of norepinephrine. Now phentermine can block this norepinephrine transporter such that it can increase the activity of postsynaptic neurons by increased release of norepinephrine. So this increases the sympathetic transmission, which can control the appetite. Apart from sympathetic activation, phentermine can also increase the transmission of dopamine as well as serotonin. All these actions can reduce the appetite and reduce the food intake. So this is the first comparison between the semaglutide and phentermine. Both show similar activities, but they act in different way. Second one is the coexisting conditions. Already we have seen that semaglutide can control the appetite by acting on the CNS, but apart from that action, it can also act on the pancreas, where it can increase the release of insulin. This can control the blood glucose levels along with inhibitory action on release of glucagon. Similarly, semaglutide can produce some delay in gastric emptying. So with all these actions, semaglutide can control blood glucose levels. That's why this drug can be used for the management of both type 2 diabetes mellitus as well as for the management of overweight in the people. On the other hand, phentermine is not useful for the treatment of diabetes as it is not controlling the blood glucose levels. It is only indicated for short-term treatment of overweight in the people. Third one is the systemic effects. Here we can find a difference between semaglutide and phentermine. Since semaglutide increases the insulin release from the pancreas, it can reduce the blood glucose, resulting in hypoglycemia. This is particularly more pronounced with administration of insulin along with semaglutide. That's why care should be taken when the semaglutide is prescribed. It may suddenly decrease the blood glucose levels, resulting in hypoglycemia, leading to development of weakness, tremors, and sweating. This is particularly more important in the diabetic people who are taking the anti-diabetic agents. So when the semaglutide is taken along with the anti-diabetic agents, the hypoglycemic effect is more pronounced, which should be closely monitored. On the other hand, phentermine is not affecting the blood glucose levels. Instead, it can increase the sympathetic stimulation, which increase the blood pressure. So elevated blood pressure is one of the important effects of phentermine. And it can also stimulate the cardiovascular system, resulting in tachycardia, increase in the heart rate, palpitations, awareness of heartbeat, and rarely it can also develop one of the condition valvulopathy, the inflammation of the cardiac valves, which significantly affects cardiac functionality. That's why phentermine should not be used for long term, as it can increase the sympathetic stimulation, thereby it can increase the cardiovascular complications. So at this point, semaglutide is having the mild systemic effects, but it should be carefully given along with anti-diabetic agents. Fourth one is the adverse effects. Here we will see the important adverse effects produced by both semaglutide and phentermine. Semaglutide can produce few of the symptoms like abdominal pain, constipation, nausea and vomiting. All these gastrointestinal side effects may be produced by semaglutide, since this drug may increase the risk of pancreatitis in the people. Whereas phentermine can produce dizziness as one of the important side effects. It can produce some lightheadedness, and since this drug is an amphetamine derivative, it can disturb the sleep, resulting in the insomnia. Some lack of sleep can be observed because of phentermine. So in those people who are having sleep disturbances or postural imbalance, phentermine should be carefully given. In such people, semaglutide is useful. But at the same time, semaglutide can produce pancreatitis. So in the patients with previous history of pancreatitis, semaglutide should not be used. Fifth one is the duration of treatment. Here again, semaglutide plays an important role. The semaglutide is given by subcutaneous injection, and it is one of the long-acting glucagon-like peptide agonist. This semaglutide can be given once weekly as a subcutaneous injection. Since it is long-acting, it can be given for every 1 week, and even the dosing interval is somewhat flexible. In case of missed dose, it can be given at any day of the week, such that at least 3 to 4 days gap is there between 2 successive doses. So there is a lot of flexibility with use of semaglutide. It can be given once weekly. On the other hand, phentermine is available as a capsule or tablet. It should be given daily. So in case of any missed dose, within the same day it should be taken. And regularity of intake is also important. Unlike semaglutide, phentermine is not a long-acting agent. It is only used for short-term treatment up to 12 weeks because of increased sympathetic stimulation. So beyond 12 weeks, phentermine is not useful due to its systemic side effects. So when you want to control the body weight, phentermine may be a better choice. But when the weight control is required for long-term period along with control of blood glucose, semaglutide is one of the better choice. Sixth one is the time of intake. At this point again, both semaglutide and phentermine somewhat differ. Semaglutide subcutaneous injection can be given at any time of the day with or without food. So again, flexibility is there with intake of semaglutide. On the other hand, phentermine capsule or tablet should be taken 30 minutes before the breakfast. It should not be given in the evening because it can produce disturbance in the sleep. That's why phentermine should be taken only in the morning, preferably 30 minutes before the breakfast. So again, the patient compliance is more with semaglutide because it can be taken at any time of the day, but Phentermine should be taken preferably 30 minutes before the breakfast. Seventh one is the doses. Semaglutide as a subcutaneous injection, it can be given at a target dose of 2.4 mg given once weekly. Initially, it is started at a low dose and the dose can be slowly increased after 4 weeks of the treatment such that the target dose is 2.4 mg given once weekly. On the other hand, Phentermine, since it is given by oral route, it can be given as a 37.5 mg as its hydrochloride salt. This 37.5 mg hydrochloride salt is equivalent to 30 mg of free Phentermine. So the dose is somewhat more compared with semaglutide as it is given by capsule or tablet form, which is having somewhat less bioavailability compared with subcutaneous injection. And even the dosing frequency is more compared with semaglutide, so Phentermine should be given daily, whereas semaglutide should be given once weekly. Eighth one is the ease of administration. From all these points, we can say that semaglutide subcutaneous injection is having the more flexibility because it can be given with or without food at any time of the day, but it should be given by subcutaneous injection. So patient should be instructed to go for self-administration of semaglutide injection. It can be given at the abdomen, thigh, upper arm, so it can produce some local reaction, local pain, which can be easily tolerated, and even site of administration may be rotated with each week in order to improve the patient compliance. On the other hand, Phentermine is given as a capsule or tablet which can be taken orally by mouth, so it is easy to administer compared with semaglutide. So at this point, Phentermine is somewhat beneficial as it can be taken without any pain. When to avoid? Now let us see the contraindications of semaglutide and Phentermine. Semaglutide should not be given in the people with previous history of any pancreatitis or patients with any diabetic retinopathy. Again, this increases the complications. And particularly this should be avoided in the people with thyroid cancer. In these conditions, semaglutide should be avoided. Similarly, Phentermine should be avoided in those conditions where they are associated with increased sympathetic activation. For instance, it should be avoided in the conditions like valvulopathy or stroke, uncontrolled hypertension, myocardial infarction. In all these conditions, Phentermine should be avoided since it further increases sympathetic stimulation. Similarly, in the hyperthyroidism, again it should be avoided as it is associated with increased sympathetic activity. And even the conditions like agitation, glaucoma, where sympathetic system is stimulated, again in such conditions, Phentermine should be avoided. So among these two drugs, we can choose one drug based on the patient conditions. In the people with any pancreatitis or thyroid cancer, semaglutide should be avoided. In the people with cardiovascular complications and hyperthyroidism, Phentermine should be avoided. 10th one, cost of treatment. Obviously, we can see that semaglutide subcutaneous injection is somewhat more expensive compared with Phentermine, which is available as a capsule or tablet. It is less expensive. So the price of semaglutide is somewhat more, but still it can control both raised glucose levels within the blood as well as it can also control the overweight, and it can be used for long-term period. It can be given once weekly at a low dose compared with Phentermine. But one of its limitation is the pancreatitis or thyroid cancer, diabetic retinopathy. In such conditions, semaglutide should not be used, and this drug should be carefully given by monitoring blood glucose levels as it can produce hypoglycemia with other anti-diabetic agents. On the other hand, Phentermine can be used for short-term period without any development of pancreatitis and retinopathy, but it can stimulate the sympathetic system resulting in insomnia, elevated blood pressure, cardiovascular complications. So in such conditions, Phentermine should not be used, but is available as a less expensive for short-term management of overweight. Phentermine can be used, which can reduce the food intake and control the appetite. So that's all about this semaglutide versus Phentermine. In order to reduce diabetes and cardiovascular complications, semaglutide plays a key role in the weight management. So that's about the semaglutide and Phentermine. That's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.